Hello everyone, welcome to my channel. So let's start in pharmacology. The next topic is glucocorticoids. So what is the meaning of glucocorticoids and why which is useful in pharmacology, the method, root, condition, side effects and contraindication we are studying in this video. So glucose and corticosteroid means any kind of analgesic which is related to glucose. So it can be treat many causes of inflammation in your body, also known as corticosteroids. They are basically comes under the steroids. The steroids have two parts: glucocorticosteroids and second one is mineralocorticosteroids. So they are synthetic human-made drugs. They are used similar to cortisol, a hormone your body natural produce. Usually your adrenal gland produced by release of cortisol. So it is action is to be like enhance the cortisol action if there is any kind of deficiency. So let's understand the mechanism of cortisol's level in our body. So it a cell which is have lipid soluble and AI and AS there is to be action, and in their lipid soluble cell which is have the glucocorticoid cell receptors which is present in our adrenal gland. It will be released over there. It will be perform the cortisols and renal action in our body. So what is that? So mood relaxing hormone. So it will be act on a nucleus which in our DNA, and it will be enhance their DNA transcription, cytokines and immune response. So that will be action you have to shown in glucocorticoid cell receptor which is present in our adrenal glands. So which kind of condition you have to be treated by glucocorticoid drugs? So condition are lupus, inflammatory arthritis which is rheumatoid arthritis, asthma, vasculitis, eczema, myositis, encephalitis, for healing after injury like bursitis, tendinitis, trigger finger and trigger thumb. So that kind of condition will be treated by the glucocorticosteroids. So what is the method of route? There you have to be taking the glucocorticoids like drugs. So it will be directly injected into the joint. If there is any kind of arthritis problems you haven't shown somewhere, a patient is directly injected their knee joint of their glucosteroids medicine or drug. Also there is have to be if there is inflammation occur in your eyes, so eye drops, nose drops, topical creams. If there is any kind of rashes and inflammation is occur in your dermis or skin, oral intervention, any kind of oral inflammation or not inflammation, there is any kind of sore occur in your mouth also over there, or intermuscular route you have to given them to the patient. If there is any kind of inflammation occur into your gut, so it will be 100% bioavailability. It will be reach out over there, and directly it will be lipid soluble, so it will be enters into the intracellular matrix as per to extracellular matrix, and so the action towards the inflammation or prostaglandins. So basically prostaglandins show the symptoms like inflammation, like redness, increased temperature, swelling and loss of function and pain. So it will be reduce their function, the prostaglandins. So next is to be side effects. So what if you're taking long-term exposure of the glucocorticoids? So there is a like side effects happen: increased appetite, like too much hungry after few hours, unexpected weight gain, as you have know you have taken too much food to have like weight gain occur in your body, acne will be shown in your face, rashes so in your dermis or skin, stomach irritation happens on your gut or stomach, muscle weakness, there is a too much fatigue or weakness, dizziness occur in your muscle, cramps will be shown, mood swings will be occur because it will be desirable mood will be shown the patient, and you have to show the increased body hair into the side effects of the glucocorticoids. So next is to be drugs and the example of glucocorticoids. So first is drug which is hydrocortisone. It is used in the adrenal insufficiency, in kind of any kind of insufficiency of adrenal and produce their hormone. So it will be helpful to increase their action. So adrenal insufficiency replacement therapy. So any kind of adrenal replacement therapy you have to hydrocortisone has to be given over there, and it will be reduce their inflammation and pain over there. Next will be peridinosinol. Peridinosinol, which is basically useful in rheumatoid arthritis, which is anti-inflammatory drug, so reduce the prostaglandin signs and symptoms. Next is to be dexamethasone. Dexamethasone is occur like present is given on cerebral edema. So it will be cerebral edema is present in our cerebral part, so accumulate of extracellular matrix. In extracellular matrix the fluid accumulation is too much, so reduce of the brain swelling, and it will be excrete out into intracellular matrix to extracellular matrix of the fluid is to be helpful to the dexamethasone drug. Next is to be betamethasone. Betamethasone is helpful for which disease, like fetal lung maturity. It will any kind of baby which is present in our pregnant woman womb, like uterus. So is there any kind of lung disease occur in their fetus? So there is a betamethasone give the preterm labor like it will be enhance their lung capacity of the baby, and during before it will be given on the before the during of labor period. So next is to be budesonide. Budesonides are the which kind of a disease you have to take in budesonide. This is bronchial asthma. In bronchial asthma, there is an inhalation therapy. So budesonides, you have to use on the patient taking the asthma inhaler. So in their inhaler, there is a budesonides which is occur. So it will be inhaled there, and it will be relax their bronchospasm into the bronchioles and relax their lung muscle. So it is inhalation therapy. Next is to be 40 fluticasone. Fluticasone, it is this will be treated in this disease like COPD, chronic obstructive pulmonary disorder, and also in asthma. So which is also the inhalation therapy or maintenance therapy, which is given by the relaxation or like opening of the bronchodilation into their lungs. So next is to be prednisone. Methyl prednisolone, which is used in spinal cord injury. So if any kind of road traffic accident, so it will be hamper your spinal cord. So it will be after the surgery, there is inflammation or swelling over there. So reduce the inflammation and swelling, which is prostaglandin activity over there. So there is a drug like methyl prednisolone that will be reduce their inflammation activity over there. Next is to be colebetasol. Colebetasol, which is useful in psoriasis patient, which is a long-term exposure into the bed, which is ICU patient, and it is a topical treatment. So it will be like a direct apply into the skin or dermis over the patient. So it is useful for the ICU patient because it will be long-term exposure into direct contact of the brain, and if there contact of the bed into the joint surface, it will be sore or like psoriasis occur. So there is too much accumulation or like regeneration of the cell occur over there. So regeneration of the cell, regrowth of the cell over there. So it will be cause psoriasis or like wound over there. So because of the joint prominent area, there is a less oxygen demand will be provided. So if less oxygen demand over there, so it will be cause psoriasis into the patient body. So colebetasol is a topical treatment which will directly apply into the skin over the patient. Next is to be contraindication, which time you have to not prescribe the glucocorticosteroids. Next is to be systemic fungal infection, hypersensitivity to drug. If any kind of patient is hypersensitivity and it is applied to the drug into the skin, there is any kind of rashes or like fungal infection will be occur. So you have to be prevented and contraindicated for those patients. Make sure you have to be consult to the doctor before taking these kind of medicines, because is there any kind of severity before you going to the doctor and consult to the doctor, so it will be hamper your internal organ and it will be long-term exposure. It will show the side effects in your body. So next is to be diabetes patient. You have to make sure you have to consult to the doctor before taking these medication. Peptic ulcer disease patient, you have to make sure you have taken these medication to before consult to the doctor. Osteoporosis, in osteoarthritis you have to be taking this medication, but in osteoporosis the decaying of the bone density level and pores will be occur. So you have to be consult to the doctor before taking medication, and as per my thought, you have to be not taking this medication. Next is TB. TB is tuberculosis. There is a lung infection, there is accumulation of the fluid. So there is a drug which is, if you have asked to me why we have not used this drug in TB. So look, in COPD, like chronic obstructive pulmonary disorder, there is a not like too much fluid accumulation or the bacterial infection. In tuberculosis bacterial, the tuberculosis bacteria they activate into the lungs and fungal bacterial infection into their lung. So their bacterial infection into their lung. So it will be like lymphocytes or neutrophils and basophils are accumulate over there, and like there is too much sputum or fluid accumulation into the lungs. So there is no chance to open their the lungs capacity over there because there is accumulation of the fluid over there. So you have to be chest physiotherapy is recommended for the TB patient, and after that you have to take glucocorticoid medication on the patient. Next is to be glaucoma, which is occur in your eyes. So it's contraindicated for this medication, or also in pregnancy. So during the pregnancy, so any kind of like pain and inflammation, make sure you have to consult to the doctor, and in few amount you have to take in diclofenac or ibuprofen or aspirin or like paracetamol or Dolo 650 or citrazine you also have taken. But make sure you have to consult to the doctor into the 5th and 6th trimesters. Next is to be side effects. If you're taking long-term exposure of this medication, there is a side effects: fluid retention, hyperglycemia, moon face. There is a moon face you have to shown. You have to some patient there is a moon kind of face. Buffalo hump, skin thinning. There is a condition you have to show on the patient.